I'm David Atkeson. I'm the Springfield office leader for J.E. Dunn. Some of the roles that I fill include being that outward face for the company, doing business development and bringing work in the door, building relationships. I'm usually involved heavily on the front end, getting the project set up for success. And then once we get into the construction phase, I'm involved in providing leadership to our construction teams through that phase as well.
I'm Geraldine Lynch. I'm the Executive Director of Planning, Design, and Construction for Mercy Ministries. My role is for the management of all new construction and renovation across our 4-state region. Well, it ranges, but we do about 350 projects a year, and that's about 60 in the Springfield area, so about 15 to 20% for Springfield. Probably
20% of our total revenue is healthcare construction on a national perspective. Here locally in Springfield, we were part of 8 healthcare specific projects this past year, and those projects made up about half of our Springfield revenue for 2020. You know, when your client's business is deemed essential and your business is deemed essential during a pandemic, it creates a very different but a very busy year. And our healthcare revenue was about half of our total Springfield office revenue. And that percentage is higher than normal. We're usually a little bit more diversified in the type of construction we do between education and healthcare and offices and governmental work. But there was just a really strong demand for healthcare projects this past year for a number of different reasons.
So I don't think we actually added any new jobs. What we did was sort of pivot our workforce to take care of our pandemic projects. And there were approximately 12 COVID-specific pandemic projects here in Springfield, and there were about 3,000 craft hours for that. The cost of those projects was about $500,000, and to put that in perspective, the Springfield region over the last 5 years spends about $40 million annually on construction. There are ancillary impacts of all the construction workers traveling to the job site on a daily basis, the gas they use, the restaurants they frequent, and the wages of all those construction workers that are spent in the local community. You know, there is no working remotely in the construction project. The tradeswomen and the tradesmen and the professional staff have to come to the job site. And in our case, the job site is the hospital.
The reach of the healthcare industry is almost endless. You know, just within our small Springfield office alone, that provided dozens of job opportunities for J.E. Dunn employees. And then when we look more broadly at subcontractors we like to call trade partners, and then you look further at the other critical aspect of all of our project. It takes our clients, it takes our construction teams, but obviously those design teams, those architects and engineers. So when you start adding those up just in the design and construction industry, there are literally hundreds and hundreds of jobs that exist because of the healthcare industry. Cox Health has been a great partner for us this past year. At their south campus in the West Tower, when that space was built originally, it had some shell space on a few different floors, and we did a number of projects in there this year to infill, to utilize that space as well. We definitely had a new project come along for Cox Health in response to COVID to construct a COVID ICU, and they reached out to our team, asked us to help them develop a plan and execute that in very short order. It's a 51-bed ICU, and the whole project came together from concept to reality in about a month. Then, unfortunately, due to ongoing and increasing demand throughout the year, we dropped back and then in December expanded the COVID unit with another 31 beds in a very similar fashion as the original build out.
We continued and we instituted safety protocols for our contractors so that we could continue working during the pandemic. There were many unexpected projects due to COVID. Some of those were temporary testing collection sites, the forward emergency department, triage trailers where we place trailers outside our existing EDs to help with the patient volume and the patient throughput, projects within the hospital to increase bed capacity, modify the existing patient rooms, and procedure rooms, installation of plexiglass, among others. We also converted our inpatient rooms to negative pressure. We went from 78 inpatient rooms with negative pressure to 267 currently at the Springfield Hospital.
Quite literally, every direction I turn, every group that I'm a part of has healthcare professionals sitting at the table, giving back, contributing, donating, serving, looking for ways to improve the organization or improve our community. I serve on the GoCaps board. Well, who are some of the most prominent and heavily engaged and involved members of that program? It's our healthcare providers. The SBDC, who are some of the most heavily invested members of the SBDC. Once again, it's our healthcare providers. So they're quite literally at the table of everything that's happening and making a positive difference. It's really hard to think of an aspect of our community that they're not making a positive difference in.